Hi guys, here are some ethical and legal issue questions. These are test questions NCLEX style on ethical and legal issues. This follows the lecture that I posted a couple of days ago. So these are questions directly related to ethical and legal issues in the mental health unit or mental health nursing, but they also apply to other hospital units. Question 1. Group therapy is strongly encouraged but not mandatory on an inpatient psychiatric unit. The unit manager's policy is that clients can make a choice about whether to attend group therapy. Which ethical principle does the unit manager's policy preserve, or which policy does it follow? In other words, the answer choices are A, justice, B, autonomy, C, veracity, and D, beneficence. And I'll give you a minute to decide what you think the answer might be. At this time, I would like to encourage you to like, share, subscribe to my YouTube channel, Nursing with Hart PhD, if you're interested in seeing more of my videos. Okay, the answer on this one is autonomy. Okay, letter B, autonomy. The unit manager's policy represents the ethical principle of autonomy, which assumes people are capable of making independent decisions for themselves, and all healthcare providers must respect patients' decisions. Okay, let's look over the other answer choices. Letter A, justice. Justice is like equal rights for all. That is that all resources should be available to all people, no matter their socioeconomic status, religion, sexual preferences, marital status, any of that. So that's equal rights is justice. Letter C, veracity. Veracity is the healthcare worker's promise to tell the truth. Okay, veracity refers to the nurse's duty to always be truthful. And letter D is beneficence. Think of the word benefit. And beneficence refers to the nurse's duty to benefit or promote the good of others. Okay, and let's look at the next one. Which statement should the nurse identify as correct regarding a client's right to refuse treatment? And I covered this in the lecture, where even patients who are involuntarily admitted to a mental health psychiatric unit, they still have the right to refuse medications, right to refuse treatment, unless they are considered to be at a risk of harming themselves or others. Okay, so let's read these answer choices. A is client can refuse client can refuse pharmacological but not psychological treatment. B, clients can refuse any type of psychiatric treatment at any time. C, the only treatment a client can refuse is electroconvulsive therapy or ECT. I will be covering electroconvulsive therapy at one time. I do have some content I would like to cover on that. And D is professionals can override treatment refusal if the client is actively suicidal or homicidal. All right, we'll give you a minute to think about this one, and then we'll come back. Okay, and the correct answer on this one is letter D. D as in David. This is correct. A client has the right to refuse treatments unless he or she is determined to have suicidal or homicidal intent, as there is a serious risk of harm to self or others in that case. Healthcare providers can override treatment refusal to keep the client or others safe from harm. Treatment may be provided without the client's informed consent. So the goal of the healthcare providers, nurses, doctors, all people, techs who are working in a psychiatric or any unit, is not only to keep that patient safe, but also to keep all the other patients safe. Okay, so if a client is threatening others, threatening other patients, doing something to them, then they're considered a threat to others. And staff or healthcare workers or nurses can step in when they need to. Okay, let's look at the other answer choices. Letter A, clients can refuse pharmacological but not psychological treatment. Okay, the client has the right to refuse any treatments unless they're determined to have suicidal, homicidal intent, and there's a serious risk of harm to self or others. Letter B is incorrect. Clients can refuse any type of psychiatric treatment at any time. So the key here is to be careful about answer choices that say always, never, any, all. So in this case, they're talking about clients can refuse any type of psychiatric treatment at any time. And that is not correct, because the exception to the rule is if they are deemed a risk of harming themselves or others, then they lose those rights to refuse. Okay? Letter C is also incorrect. They do have the right to refuse but that's not the only treatment that the client can refuse. Okay, is electroconvulsive therapy. If they're not harming themselves or others or at a risk of doing so, they can refuse medications, treatments, so on and so forth. Okay, and that's it for that question. Let's go on to the next one. A client diagnosed with schizophrenia. I haven't covered schizophrenia yet. I will be covering that very soon in my content lecture. Client diagnosed with schizophrenia refuses to take medication, citing the right of autonomy. In other words, the client is saying, I have the right of autonomy, I can refuse my medications. Under which circumstance would a nurse have the right to medicate the client? Okay, and here are your answer choices. Makes inappropriate sexual innuendos to a staff member. B, repeatedly demands constant attention from the nurse. C, physically attacks another client during group therapy. Or D, refuses to bathe or attend to personal hygiene. So we're thinking about in what situations would the patient lose their rights, and then the nurse can medicate the client without their consent. Okay, we'll give you a second on this one and we'll come back. Okay, so think about which one of these situations where the nurse has the right to medicate the client even though they have refused to take the medication. Okay, and the correct answer is letter C. Physically attacks another client during group therapy. So the nurse can legally medicate a client against their wishes if the client physically attacks another client or they pose a significant risk of harm to others. The client's right to accept treatment, the client's refusal to accept treatment can be challenged because the client is endangering the safety of others. Okay, let's look at the other answer choices. Letter A, makes inappropriate sexual innuendos to a staff member. This is rude. They're going to have a conversation with the client, I'm sure. This does happen in the psychiatric mental health units that I've been at, or even a med-surg unit in the hospital, especially if someone comes in on a Baker Act and they've been intoxicated, something like that, or under the influence. But this is not a reason to take away their rights. Letter B is not correct. Repeated demands for constant attention from the nurse. Just because they're looking for constant attention, you can't take away their rights for that reason. It's only if they pose a significant risk of harm to others. And letter D is also incorrect. If the client refuses to bathe or attend to personal hygiene, that happens. Again, that happens in the psych unit. The techs and the nurses can encourage the client. The doctor can have a conversation with them about their personal hygiene, but you can't force someone to take a shower or bath. Okay, so the taking away the rights of a client is very specific. The law is very specific. It's only in the case where they're considered to be a danger to themselves or others. Okay, next question. A psychiatrist working on an inpatient unit refuses to treat clients who do not have health insurance coverage, and also prematurely discharges clients whose health insurance benefits have expired. The nurse recognizes the psychiatrist is violating which ethical principle? All right, and your answer choices are A, autonomy, B, beneficence, C, non-malfeasance, and D, justice. I'll give you a minute to think about this one, and we'll come back. Okay, and on this one, the correct answer is D, justice. The psychiatrist, in this case, has violated the ethical principle of justice, and that requires individuals to be treated equally regardless of race, sex, marital status, medical diagnosis, social standing, economic level, or religious beliefs. So just because the insurance has expired, the psychiatrist cannot take away or cause the patient to be discharged prematurely. Okay, let's look at the other answer. Choices, autonomy. Okay, autonomy is the right that the client has to make choices. B, beneficence. Beneficence is one's duty to benefit or promote the good of others. C is not incorrect. C is incorrect. Non-malfeasance is the requirement that healthcare providers do no harm to their clients, either intentionally or unintentionally. Okay, so the correct answer on that one is justice. Okay, next one. Which situation contradicts the ethical principle of veracity? So you have to know what veracity is on this one. A nurse provides a client with outpatient resources to benefit recovery. Letter B, a nurse refuses to give information to a physician who is not responsible for a client's care. Letter C, the nurse tricks the client into seclusion by asking the client to carry linen to the seclusion room. And letter D, a nurse treats all clients equally regardless of the acuity of their illness. Okay, we'll give you a minute on this one and we'll come back. Okay, and the correct answer on this one is letter C. The nurse tricks the client into seclusion by asking client to carry linen to the seclusion room. So wouldn't that be pretty horrible? That would be very horrible if the nurse asks the client to carry linen into the seclusion rooms and then shuts the door on them and locks them in. That would be false imprisonment, and the nurse could actually have charges taken against them. So the principle of veracity refers to one's duty to always be truthful and not intentionally deceive or mislead clients. Okay, that's veracity. So let's look at these other answer choices. The nurse provides a client with outpatient resources to benefit recovery. Okay, that has nothing to do with being truthful or not being truthful. Letter B, a nurse refuses to give information to a physician who is not responsible for the client's care. Well, that's HIPAA laws or confidentiality. That's what that one is. And then letter D, a nurse treats all clients equally regardless of the acuity of their illness. And that has to do with justice, treating all clients equally. Okay. All right, we have a couple more. Question 6, which situation exemplifies both assault and battery? Letter A, the nurse becomes angry, calls the client offensive names, and withholds treatment. Letter B, the nurse threatens to tie down the client and then does so against the client's wishes. Letter C, the nurse hides the client's clothes and medicates the client to prevent elopement. Letter D, the nurse restrains the client without just cause and communicates this to family. Okay, we'll give you a minute to think about this one and we'll come back. Okay, and on this one, the correct answer is letter B as in boy. The nurse threatens to tie down the client and then does so against the client's wishes. So this is correct because the nurse has committed acts of both assault and battery. Okay, assault refers to an action that results in fear and apprehension that the person will be touched without consent. And battery is the actual touching of another person without consent. Okay, so in this case, the nurse threatens to tie down the client, and then they actually tie down the client. Okay, and the nurse, if the nurse did this and was reported, would be in great trouble. Okay, you're risking your license at this point. Okay. And you can have civil charges or criminal charges brought against you for assault and battery. So be careful. Okay, let's look at the other answer choices. Letter A is incorrect. The nurse becomes angry, calls names, withholds treatment. Okay, that is not assault and battery. And letter C, the nurse hides the client's clothes and medicates the client. Okay, hiding the clothes and medicating the client to prevent elopement. Okay, that can be false imprisonment. Okay, and you can have charges brought against you for that. Elopement is when a client tries to escape. At the psych unit that where I took students, there were 2 doors going to the entrance and exit, and both of them required a key card to open the door. So you hit the key card on the wall, the first door opens, and then there's a space where there's the rec room and other offices, and then you go to the right and there's a second door to the exit to the outside, and then security is right there. So it's very secure. If the what some clients would try to do, and it did almost happen a couple of times, the clients when they see students coming in, they're thinking they're manipulative in some instances, and they're trying to think of ways to sneak out. So they see students and they think, oh, I can sneak behind because there's a line of us, say there's 6 of us, 7 of us, including me, and I have 6 students behind me. I would always say, make sure the door, last person, make sure the door behind you closes all the way. Make sure no one is following you, because the client who is trying to escape will try to sneak, in between the door behind the last person. And one time I think I had to call the tech to help us because there was a client who was hanging around close to the door trying to sneak through the door. But even if they do, then there's a second door, and so if they sneak through the first door, they're stuck. There's nowhere they can go unless they get through the second door, and even then security's right there and security's going to see them. They don't allow anyone in or out unless you're buzzed in the front door. So it is a very secure unit. So that's what elopement is. And a lot of times, if a client tries it once, it goes in their chart and it goes to the next nurse and report. This client so-and-so is at risk of elopement because they did this and tried to sneak out. Okay, sometimes they'll try to push on the doors and try to open them, and then the alarm goes off and security is called to the unit. Okay, I think this is the last question. A man calls the psychiatric unit to speak to his sister. The nurse connects him to the community phone, and the sister is summoned. The nurse later realizes that the brother was not on the client's approved call list. What law has the nurse broken? Let's go over the answer choices. National Alliance, letter A, National Alliance for the Mentally Ill Act. Letter B, Tarasoff ruling. C, Health Insurance Portability and Accountability Act, or HIPAA laws. And letter D, Good Samaritan law. So we'll give you a minute on this one and we'll come back. Okay, so on this one, letter C is the correct answer. It's the HIPAA laws that covers this, laws of confidentiality. I just want to address this stem of the question where I never saw the nurses in the nurses station would take a call and they would handle it. They're not going to transfer a call to the common area. They're just not going to do that. I'm sure the community phone is for clients to use. They're limited during certain times. They turn them on and off. During group and breakfast and meals, they turn the phones off. But they're not going to, I don't believe they even have the ability to transfer calls from the nurses station to the community phone. And the nurses, trust me, is not going to do that. If the person is on consent, probably what would happen is the social worker would be notified, or the therapist would be notified, that this person's family member is trying to reach them, and the therapist or social worker would initiate a phone call from their office, and the client might be present. And that's what I've seen in my experience. But they're not going to transfer a call to the common area. Let's look at the other answer choices that are incorrect. National Alliance, that doesn't even exist. That's not even a real thing. B, Tarasoff ruling. Tarasoff ruling is a landmark legal ruling. It requires mental health professionals to breach patient confidentiality to protect unidentifiable third parties from foreseeable harm. In other words, that's the duty to warn policy. And letter D, Good Samaritan, you may be familiar with that one. This protects bystanders who voluntarily provide reasonable emergency assistance to injured or incapacitated individuals. So as you, as a nurse, sees a car accident and someone is on the side of the road and the ambulance hasn't arrived yet, you may wish to pull off and see what assistance you can provide. And that's the law that protects you from any legal action, is the Good Samaritan law. Protects bystanders who voluntarily provide emergency assistance. Okay, and so that's it, and that's on ethical and legal issues, and we'll see you on the next one. Have a great day.